Hi there, I'm Dr. Kukar, and I'm going to take a minute today to talk to you about kennel cough. Kennel cough is a catch-all term for an upper respiratory infection in dogs. And these type of infections can be bacterial or viral in nature. They tend to be highly contagious from dog to dog. So the dogs most at risk for contracting this type of infection would be dogs in any type of boarding facility, a grooming facility, dogs that frequent dog parks, or even going to the veterinarian can be a risk factor for contracting an upper respiratory infection. The incubation period for kennel cough is highly variable, but generally about 3 to 5 days from time of exposure. The symptoms of these type of infections, the most characteristic is a honking, dry, non-productive cough. Sometimes accompanied by nasal or ocular discharge. Most of the time, the dogs otherwise seem to feel pretty well. Most of the time continue to eat normally. Many times dogs don't require any treatment at all for upper respiratory infections, particularly if they're otherwise healthy. If they are very young or very old or have some other medical condition that may compromise their immune system, then sometimes I will treat them with antibiotics or cough suppressants or other types of medications on a case-by-case basis. The prognosis for upper respiratory infections is generally very good. Most of these dogs recover without any long-term effects. In a matter of a couple days, it's really just more of a nuisance more than anything serious for them.